Has the latest COVID-19 wave in the U.S. peaked? The daily average of new coronavirus cases has fallen to below 100,000 for the first time in roughly 2 months. The latest coronavirus wave in the U.S. appears to be receding after a relentless plateau that lasted most of the summer months. The daily average of new coronavirus cases dropped to below 100,000 for the first time in roughly 2 months, according to data from the Centers for Disease Control and Prevention. Average daily infections as of Tuesday fell to roughly 99,000, down from 130,000 a month ago. COVID-19 hospitalizations have also shown a slight decline, while about 400 Americans with the coronavirus die on average each day. The latest wave, which was fueled by several omicron subvariants, including BA.2.12.1 and BA.5, brought a steady onslaught of new infections, including among President Joe Biden and First Lady Jill Biden, as well as increasing reinfections. While the wave looks to have crested, the numbers remain elevated with few mitigation measures in widespread use, begging the question, is this the country's new normal? Extended at this rate, it would mean a yearly death toll of about 145,000. Such a number would be lower than previous COVID-19 death tolls, 415,000 in 2021 and 350,000 in 2020, but still among the top 5 causes of death in the U.S. That's not necessarily where we would hope to be, I think, but I don't know where the appetite is to do better than that at this point, says Jeffrey Shaman, an infectious disease modeler and epidemiologist at Columbia University. It's sort of human nature to get fatigued by things and also to normalize things that initially are abnormal, and I think that's kind of where we are. Underscoring this mentality was the CDC's COVID-19 guidance update last week, which ended quarantine recommendations for anyone who has a suspected exposure to the virus. The change did not spur from an improvement on the ground, as coronavirus deaths are widely considered by health officials to be too high, and over 93% of counties are seeing high levels of coronavirus transmission. Instead, the agency cited the availability of coronavirus vaccines and treatments, high levels of immunity against the coronavirus, as well as a desire to limit social and economic impacts in a report published alongside its decision. Richard Carpiano, a professor of public policy at the University of California, Riverside, calls the CDC's changes very disappointing. It seemed almost like a bit of a concession or a surrender to a normalization of, "This is the COVID status quo," he says. While Carpiano says he appreciates the changes could be an effort to meet people where they are, considering many Americans aren't following the CDC's guidelines anyway, he still says the agency should be setting a stronger example for the rest of the country. "We do need a parent in the room," Carpiano says. "We do need to have certain adults around to be like, look, here's what the reality is, for people to be able to make better, more informed choices." The latest changes also go against guidance from the World Health Organization, which states that contacts at high risk and those living in high-risk settings, who have not completed a primary series or received a booster vaccine dose, or who have not reported a previous infection in the last 90 days, need to quarantine for 10 days. Quarantine can be shortened to 5 days if the person tests negative on day 5 and presents no symptoms. "The public is tired of it," WHO Incident Manager for COVID-19 Abdi Mohammed said this week when asked about the CDC's change of guidance. "Even us, we are tired of it. But the virus is not tired of us, and every day is bringing new tricks up its sleeve." Over 200 omicron subvariants are recorded. Some of them are gaining more momentum. Experts warn that while cases appear to be on the downturn, coronavirus is expected to surge again in the fall and winter. Whether the future waves will be fueled by the BA.5 subvariant or something that has yet to start spreading in the U.S. is unclear. The Biden administration is expected to push updated coronavirus booster shots as a way to combat the expected surges. Ashish Jha, the White House COVID-19 response coordinator, said on Wednesday that the shots will be available to teens and adults in a few short weeks, adding that they should work much better at preventing infection transmission and serious illness than the current vaccines. But experts aren't sure how many people will be willing to get the shots, considering the majority of Americans are under-vaccinated and only a third of people ages 50 and older who are eligible for a second coronavirus booster shot have gotten one. If we go by the same playbook of what we've been doing, I think the effectiveness of any sort of new vaccine is going to be minimized, Carpiano says.